Good afternoon to everyone on the East Coast. If you're on the West Coast, good morning. We are excited to welcome you to the Public Health Working Group's third webinar. It's on the intersection of public health, natural disasters, and trust in government. Before I turn it over to Carolyn and Louise, I just want to take a quick moment to plug that fellow nominations are closing within about a week. So next Thursday, on April 30th, nominations will close. So we really ask that if you have anyone in mind that you'd like to nominate to be a fellow, please get those nominations in as soon as possible. And if you have any questions or concerns, you can reach out to me, Jillian McGuffey, and I'll put my email in the chat as well. That's all for me, but we look forward to getting this event started. So I'll let you take it away, Carolyn.
Much. As Jillian just mentioned, this is the third of three webinars that we are hosting as part of NAPA's Public Health Working Group. The first one, we've all of them have focused really on thinking about potential disaster response issues in the public health sector. So this is actually a fairly broad possible topic when you think about everything happening in public health today. And so the previous webinars have thought a little bit about intergovernmental cooperation and how we manage crises. And we're talking about, disaster responses in terms of weather-related events, public health-related events, and many others that we think about and anticipate over time. For example, we are currently anticipating there could be a super El Nino coming, and we know that communities are already trying to understand how can they better prepare and coordinate for these situations. And we've also talked a little bit in this context about some of the societal issues around responding to this. So, for example, issues related to access to healthcare, food security, housing, and other challenges that occur during disasters, as well as how we get information to people. And so, as Jillian mentioned, one of the themes that we saw coming up as we explored how we should focus in this final webinar was the challenge of getting good information out to the public, but also for that purpose of coordinating and managing what happens in the face of a public health disaster. So I'm really excited today to introduce to you the three panelists that we have with us. I also want to mention, importantly, Louise Comfort, who has co-led this NAPA Public Health Working Group and been an instrumental person in, creating the ideas and bringing together the people who can contribute to discussions about these important issues. Today we're going to hear, and I'm going to go in the order of presenters, first from Rich Callahan. Rich is a professor at the University of San Francisco. He has a joint appointment with the USF School of Management and the School of Nursing and Health Professions. He's also the co-director of the USF Master of Public Health program in Sacramento and the director of the Health Service Administration concentration, the Master of Public Administration School of Management. So he brings a wealth of research and administrative experience to these issues. We also have with us Maria Aristigueta, who is a professor emeritus at the Joseph Biden School of Public Policy Administration at the University of Delaware. Maria has rich expertise from her experience running research centers on organizational behavior and performance in the public sector. And particularly, she's going to talk about important issues related to trust right now and draw a bit about our experiences from the COVID pandemic. And then we're also very excited to have Geno Migliaccio with us. He is a professor and associate dean for the applied public health at the Milken School of Public Health, professor of global public health, and director of the Doctorate of Public Health program at George Washington University. He also serves as a chief executive officer of public health strategies, which assists healthcare organizations with programs on leadership and organizational development, very critical to issues we're going to talk about today. And he's also served for 35 years in government in various healthcare capacities, including as commissioned officer in the U.S. Public Health Service and in the U.S. Air Force Medical Service Corps. So We are thrilled to have such outstanding expertise with us today for this discussion. And I am going to ask Rich to lead us off. Each presenter will give some initial comments for about 10 minutes, and then we'll transition to taking your questions and to other moderated discussion among the panelists.
Carolyn, thanks very much, and thank you. It's great to be working with Luis and Maria and Carolyn on this, and Geno. Geno and I worked together on a study that Ken Kaiser co-chaired on COVID and the intergovernmental dimensions of the response to that. So really appreciate a chance to work together and welcome our distinguished audience. And so my intent is really to be provocative and put some questions out there. In terms of looking at this and moving forward. So let me just share an outline and I'll talk off of that. And for me, the central issue, and it's not about performance in emergency response and in public health. It's really about the question of trust and placing the question of trust central to this. And I draw on an essay from a colleague of mine, Dr. Morgan McDonald, who heads up the national programs on leadership for the Milbank Memorial Fund. And she's an amazing person to work with. And she had tremendous insight as a volunteer, where she went not as an MD, but just as a resident and a volunteer to Washington County, Tennessee, which was devastated by floods last year. And she had a brilliant essay that really outlines the central question there is really the distrust of the federal government and particularly FEMA. And another insight that she had is if the different levels of government don't trust each other, how can you expect the public to trust each other? So I think we've had the luxury or the taken for grantedness that there's a certain level of friction in the intergovernmental system. And that taking for granted, or that we really don't have that luxury of saying that there's always going to be friction or distrust or concerns about performance between different levels of government. So both on the individual layer and then the intergovernmental layer, there's really work to be done. And I think the work really needs to start both in public health and in emergency management with the question of what are the barriers to trust? We tend to treat trust as an interpersonal commodity, but it's much more than that, or an interpersonal transaction. And I think we need to really shift from lessons on trust at the individual level to what are the barriers across individual, community, organizational, and institutional layers. And so to get insight into this, I drew on the research of from international affairs, from international relations, the research on legitimacy and service delivery in fragile and conflict affected states. And I want to crosswalk that research to give us insights into what we're trying to wrestle with of really bringing together public health emergency management and more. And so the first piece that we really take for granted, but is a significant problem is we think that if we improve service, people will increase trust in what we're doing. But there's a great difficulty in attributing credit or blame to performance. When you're receiving services in an emergency situation, is it easy to identify it's from, LA County Department of Public Health? It's from FEMA? It's from County Department of Public Works? Any of these could have been involved in the Altadena fire. Is it a neighboring fire department? So we tend to really think that it's easy for citizens to attribute or blame the correct unit of government. That's not the case. Second, it's really difficult. We talk about trust as if it can be measured easily, but the idea of trust, it's very difficult. Claire McLaughlin points out to aggregate measures. We can disaggregate by level of government, but even that, think about that. If we do the measures, the typical measures of trust, and we say, well, there's less trust of the federal government than state government, less trust of there's more trust of local government than of state. How complex is local government? And we're aggregating people as trustworthy of the LA County Fire Department and Altadena as they are of the Department of Public Works issuing housing permits. I think we need much more disaggregation of what we're talking about and how to really address questions of trust. Three, there's really always a shifting set of expectations. The public's expectations can move over time. Uh, McLaughlin talks about initial concerns over access to really concerns about the quality of care or the quality of response and the cost. And also, I would add to that the timeliness of response. Fourthly, the real barrier is that all of this is subjective judgments of individuals. We treat it as if some objective measures can really sway people in terms of trust. Fifth is it really depends where you stand in terms of the relation to the service and how you will feel about what you're getting from the Department of Public Health or from FEMA or from CDC or from a local emergency responder. Um, the relation is very different. And someone not affected by the building permit issues in Altadena might have a very different and more trusting approach or less trusting approach than someone who's been serviced by and received a quick turnaround on housing permits in the county unincorporated area there. And the technical requirements of the service makes a difference and is a real barrier to how we develop trust with individuals. So, and with communities. So, given these barriers, my major point in getting us started is we really need to shift to research and practice that gets at identifying and specifically responding to these types of barriers of challenge of building trust in emergency response and public health. And so the first piece, and we're accomplishing this today. I mean, just working with Louise and Carolyn, myself, and Geno and Maria, and seeing people in the audience, this is very much an interdisciplinary approach. And I think of how Eleanor Ostrom described her work, which leads to a Nobel Prize, and notes that the problem is too big for any one discipline. And I think what we're talking about today exceeds the capacity of only public health, only emergency management, only political science, only public administration. So clearly moving forward, designing interdisciplinary dialogue and responses. Two is really what Don Kettle says after writing about Hurricane Katrina in his article is the worst yet to come. We need to make a conscious effort to replenish intellectual capital, to let go of the things that we cherish from the past and find out what works today and what will work in the future. And that starts with, and the dean at Sandra Galeo, dean of a school of public health, he really, again and again throughout this year in his Substacks, has emphasized we have to have a candid assessment of what hasn't worked. I mean, it's well established in the research, whether it's Carl Weick on high reliability organizations or Jim Collins in Good to Great, as he puts it. Unless you're willing to confront the brutal facts, you can't have increased performance. And so, as a field, as a set of discussions, Galea really points out, and I think we would all agree, let's get a candid assessment. Let's not just see that our discussion today is a discussion about how does emergency management, public health, and other disciplines and fields work together, but really see the fundamental connection of this work to democracy. And the Napa Fellow and Dean out at the Goldman School, David Wilson, does some amazing research, really disaggregating trust and questions across levels of government, across individuals, and what are the implications for democracy? And then I just want to finish up with where we started, which is really seeing NAPA as a catalyst, bringing expertise together, convening, and trying to move these important issues forward in a nonpartisan way. Ken Kaiser, in a recent presentation, another NAPA fellow, talked about the emergency response problems are only going to be more acute. NAPA's recognized that through the work of the on weather resiliency, the Mark and Jane Pisano gift that Julian is working on, and others at NAPA. And so there's an urgency and an impact to the dialogue that we're having today and moving forward. And I put these out as opportunities to really move this dialogue forward. So thank you.
Wonderful, Rich. I really appreciate you getting us started. And also, I think pointing out that one of the reasons why we're doing this through NAPA right now is because it does help us bring not only people from different disciplines, but people with a very wide range of experiences, people who've worked in government and served in government. I also appreciate you pointing out that, thinking about how to strengthen our democracy is not partisan issue. It should be nonpartisan issue and something that we need, very much to work toward for the purpose that we're discussing here today, right? Helping us to be prepared to work together in the case of emergencies. So thank you so much. I'm going to turn it over to Maria now to continue this conversation.
Thank you, Carolyn. And thank you, Rich, for that introduction. I think it leads really well into what I'm going to be talking about. And like Rich working with Geno during COVID, I had the pleasure of working with Louise on a panel with ASPA, looking at vaccination and hesitancy towards vaccination during COVID. So it's a pleasure to be here with all of you today, and I thank those of you that are in attendance for being with us. So my role here is to talk about trust, but also apply that to how COVID has affected trust. I'm going to start by saying that most of the evidence shows that experiencing natural disasters, whether it's a tsunami, an earthquake, a typhoon, or a volcanic eruption, reinforces trust and cooperation. Yet the COVID-19 pandemic differs from other calamities. The COVID-19 pandemic severely impacted public trust, causing a significant decline in confidence in physicians, hospitals, and scientific institutions. In the US alone, trust in physicians and hospitals dropped from 71% in April of 2020 to 40% by January of 2024, directly correlating with lower vaccination rates. Factors like political polarization, communication gaps, and perceived lack of transparency influence this decline. The decline in institutional trust led to lack of confidence in scientists and physicians, which dropped significantly over the course of the pandemic. We did see a little jump in trust in scientists later in April, but again, the fall was from 58% in April 2020 to 36% by April of 2025. Trust in scientists is the key driving force behind individual support for and compliance with favorable attitudes towards vaccinations. The drivers of mistrust during COVID reduced the levels of trust were linked to factors such as being between the age of 25 and 64, identifying as female, having a lower income, living in rural areas, and exhibiting partisan differences. Trust in social media correlated with decreased vaccination rates and increase in excess mortality at 3 different time points over a 2-year period. We have seen trust increase in strangers, as several reports have indicated that experiencing COVID-19 led to an increase in trust towards strangers, frequently motivated by dependence on community support and acts of altruism. When participants are prompted to consider the health uncertainties posed by COVID-19, there are 8 percentage points more likely to express trust in strangers. In some regions, trust in government increased temporarily. The rally around the flag effect was the term used, but this often dissipated, especially where pandemic management was seen as ineffective. So what have we failed to understand or implement? I'm going to emphasize 4 areas. I think we need to leverage both institutional and personal influences. I think we need to provide scientific and anecdotal evidence. I prefer to think of what Louise refers to as storytelling or case stories. We need to engage in youth ecosystems or ways of communicating and gaining information. And finally, we need to activate trusted community networks. In leveraging both institutional and personal influence, conventional scientific and medical authorities no longer hold exclusive sway over individuals' health-related decision-making. To effectively influence health choices, experts need to adapt to emerging standards of credibility and communicate in a more personalized manner. We need to prioritize both the scientific and the anecdotal evidence. For the general audience, individual experiences with health concerns are as impactful as extensive longitudinal research. Anecdotal evidence is not opposed to science. Rather, it serves as a means to communicate scientific findings effectively to the general public. We need to engage in the youth health ecosystem. Youth across the globe are engaging with and producing health-related content at an impressive pace. It is essential for institutional representatives to increase their visibility and actively participate in relevant platforms to effectively contribute to the dialogue. And then finally, we need to activate trusted community networks. Healthcare providers remain the most trusted sources. However, when individuals' needs are unmet, they often seek support from friends, family, and others facing similar health challenges. It is essential for institutions to acknowledge this reality and actively promote peer connection alongside transparent communication. Thank you.
Thank you so much, Maria. I think, many important points in your conversation. I also think it's really important for us all to consider that, the trust in what we typically thought as, pretty clear scientific voice and evidence has waned. And you also mentioned people turning to alternative sources, and we think about, the growing role of AI in those types of sources, but also, how social media has channeled people in different ways towards different platforms and sources. So yes, it can be a very confusing time and difficult time to cultivate trust, especially in times of crisis when people may even have less time and attention to figure out what are the best sources. So I'm excited now to turn it over to Geno, who is going to share from his very rich experience more on these topics and go into depth in other ways we've experienced these issues.
Thanks, Carolyn. I also want to thank Maria and Rich for setting the stage. I think we've got some important issues to talk to today, and I've got about, I don't know, 5-8 minutes. I just want to kind of give a little overview. When I thought about, and when we got together for planning sessions, and with the topic that we are looking at, the first thing that came back to me was an experience that I had when I was a public health service officer. And I was assigned to go out to Houston, Texas, to support a dome-to-dome transfer during Katrina from the Superdome to the Astrodome in Houston, and so I wanted to give that experience in terms of, I call it Katrina, lessons learned and the failure to learn, and what keeps us from learning. So that kind of just played over in my mind when I thought about, in terms of putting together some comments for today, in terms of, we've been through this, and I'm going to take you back 20 years. Just think of where you were back in 2005, and that's where we're going to go today. And then we can fast forward, because
Maria and Rich talked about that. They talked about what we all experienced together during COVID. So I'm going to draw some parallels to COVID as we go through our Q&As together today. So imagine this. It's August 29th, 2005. The levees shattered. 80% of New Orleans disappears under toxic floodwaters. Inside the Superdome, shelter of last resort for 25 to 30,000 souls, mostly low income, Black families, elderly and disabled who had no cars, no way out. Hell unfolds. No power, searing heat, failing toilets, scarce food and water. Then comes the thought process was from the leadership, let's do a dome to dome transfer. Houston, Texas, 200 plus miles away from New Orleans, agrees to take on approximately 27,000 individuals that were inside the Superdome, and the buses poured in. Buses, can you imagine the buses that have to transport 25,000 individuals from one city to another? So hundreds of buses carry 25,000 exhausted, dehydrated, traumatized people straight from that Superdome nightmare to Houston's Astrodome. The complex swells to about 27,000 individuals on site, and Houston during that time frame absorbs 250,000 evacuees in days. The buses rolled and people followed, and they kept on pouring into Houston, Texas. I was there as a U.S. Public Health Service officer, standing up to Katrina Clinic inside that Astrodome. We triaged wave after wave. 74% arrived with serious chronic conditions. We logged about 11,000 patient visits in the first weeks. Norovirus outbreaks exploded. And then in that single mega shelter alone, 37 confirmed evacuee deaths alone in the Astrodome in the first several weeks. 23 of those were elderly from heart failure, diabetes complications, and renal failure because their meds and dialysis disappeared in the chaos. Nationwide, Katrina claimed 1,500 lives in Louisiana alone and nearly 1,800 in total. Many preventable, many from the very public health and medical coordination failures we're still talking about today. And here's the gut punch. We wrote the after action reports. We identified the lessons, unified command, equity first planning, surge capacity, whole community response. Yet here we are 2 decades later, watching the same equity gaps, the same coordination breakdowns, and that same erosion of trust play out in the COVID pandemic and beyond. Why? Because knowing the lessons is not the same as learning them. And today, I'm not here to rehash history. I'm not here to confront it. I'm really here to confront it from the floor of the Astrodome where I lived it, and demand that we finally turn those hard-won lessons into unbreakable operational reality. Because if we don't, the next Superdome to Astrodome moment, whatever form it takes, will once again devastate the most vulnerable and shatter whatever trust in government still remains. I think about those lessons learned on paper. We all know it well. There were White House reports, congressional reports, public health after action reports. They all came to the same thing. We need a unified command and a clear ESF-8, the public health medical leadership. We need pre-positioned medical surge, special needs evacuation, inoperable communications, and equity mapping. We talk a lot about whole community planning that puts vulnerable populations first and sustained accountability so after action recommendations actually get implemented. But what's that failure to learn that we repeated in COVID and that we also see in any kind of disasters that we confront? It's coordination silos, delayed patient movement, fragmented medical response, equity, trust keeps eroding because government looks incompetent or indifferent when the most vulnerable suffer visibly. And we've heard about it from Rich and Maria, that trust it's always going to be amongst us. We always hear that communication is, you could probably, any after action report you're going to write, communication is going to be centered. And now we're dealing with the explosiveness of social media platforms that can drive the narrative. And that's something that we've really got to pay attention to. We also see what keeps us from learning is political cycles and a short institutional memory, that feast or famine funding that stars public health between disasters. We thought we'd see much more pour in after COVID, and we haven't. And we're building ourselves and designing ourselves for the future with the same, that we're going to repeat I guess you would call it the sins of the past. I'll stop there and stand for questions, but I wanted to use the case as just as an example of where we've been, where we've headed, and what we need to do to confront this.
Yeah, thank you so much, Gino. There were so many important things you highlighted in that case, as well as more broadly about kind of where we are today. And I really appreciate you bringing out the equity implications. One of the things we've seen in COVID and other disasters, that some of those most vulnerable groups are often those people working on the front lines of disaster cleanups, and people become vulnerable, because of that role in their health and elsewhere. And also that those are groups that, especially today, may have even less trust or confidence in government, or fear of interacting with government. So I think it's really important that you highlighted that. And so in my role as moderator, I am going to start out with a few questions for the panel, but I'm also very happy to be interrupted at any point. And also Jillian will watch the chat. And so she will make sure I see questions that are coming up. So I'm going to go ahead and start with one question, but I see there's already a question in the chat. So I will mix mine with those that arise in the chat. So the first thing I just wanted to do is kind of reiterate, I think, a shared theme that came out from all three presentations, is that, in our current political and social context, many people are accessing information through very narrow channels, and may no longer look to government officials or sources as the most credible information. This, declining trust over time. So, the concern of how do we overcome this deepening public mistrust of our institutions, especially in the face of disasters and crises, where we know that individuals' lives and well-being may depend on their receipt of that information or follow through information provided by the government. So, for example, one thought is like, can governments collaborate with other trusted local community institutions, organizations? I know, Rich, you pointed out that sometimes people don't even understand exactly where the source of that assistance is coming from, or who they should be thanking for the supports that they get. So I'll just pose that to all three of our panelists, since you each touched on this issue of, how do we navigate this particularly challenging territory, anticipating that, people interacting with government is trusted source of information, follow through is going to be critical in coming crises and disasters.
Let me just jump in first, just in order of things. Two things. One, and this ties very closely to your question on state and local. I'd like to introduce a valued colleague of mine who's joined us for the call, Dr. Renea Dodson, who's the state epidemiologist and director of health transformation for the Mississippi State Department of Health. So, Rena, great to see you here, and really appreciate you joining us and the expertise that you bring. And Carolyn, on your question, really to get at the answer to that is way before the disaster strikes. Building those relationships and um, uh, having a sense of who does what and when. And the saying that everyone here knows better than me is, you can't be exchanging business cards at the incident command center. That lesson really applies much earlier on the governmental side of this, and focusing in on that at the front end. So when a disaster does come and you're working in interdisciplinary fashion, some groundwork has been laid. So that's where I just start off on, but I'd certainly absolutely welcome and want to hand off to my colleagues their insights.
Maria, you still muted.
So, following Rich here, if you look at the trust data, I think the closer we are to government, or the closer that government is to us, the people, the greater the trust. The trust seems to be much more effective when we're farther and less known, right? So I think this community network conversation that we have had within this, with with this panel is an important concept to think about, is how can these networks be utilized to help disseminate some of the information and get information out to the vulnerable population and the populations that are have less information attainable to them.
Geno, did you want to add anything?
Yeah, I think, just in terms of rebuilding trust and enhancing communication, we know how to write great plans. We know how to diagnose a lot of things. And I think we really have a better appreciation for how to maximize the social media, the social platforms that we have to get messages out. I just think we have to have more sustainability and more implement. We have to really focus on driving these plans into actionable operational components within the organizations that many of us lead or have led, and just ensure that we carry things to fruition. We have a tendency to kind of move quickly, but communication and trust is always going to be part of where we're at right now. COVID has really put a magnifying glass on that, and then the political climate that we live in. So it's pretty tough, but I think that's exactly the hard work that we have in front of us, is really the communications piece.
Mhm.
And how to deliver rapid information quickly to get in front of things. If we don't, we're going to be overtaken by a lot of the pundits and talking heads that are out there.
Yeah, and I want to bring up, there's two comments in the chat from Jennifer Brinkman and Oksana Marico. Jennifer asks, can you voice how not demonstrating care and empathy for the most vulnerable erodes trust broadly, and how can how a response lens that prioritizes the most vulnerable can build trust? And then Oksana asks, or points out that trust grows when institutions show consistency, transparency, and real care for vulnerable communities. And so I think this is really important because, right now I feel like we already know that the most vulnerable among us typically suffer the greatest, negative consequences of disasters and crises. They have fewer resources for coping with them, may not be able to escape like others can, or have those kinds of plans. And then, as I mentioned earlier, oftentimes they end up being part of the disaster response or on the front lines, which also puts them in varying risks, and whether they would like to be or not. And so I feel like this is a really important question. If we truly care about those who might be most negatively impacted by these things, we have to think about how within our communication from the government sources and others exudes this kind of empathy and care that will help build trust with that population. I think we've been seeing some examples recently where it's been quite the opposite. Some of these communities feel, or people within our communities feel, very much under attack. So I think it's an important issue to raise, and would love to know if anyone in the panel wants to comment on that. I think that, Maria, in part it goes to the point you were making about how getting closer to the people, and we may have to rely on certain organizations that have built that type of trust with particular vulnerable groups, and then how do we bring them into the public response?
If I could just give kind of a voiceover I'm in St. Louis in the Office of Recovery, working on the recovery from an EF3 tornado that hit the north side of the city last year, destroying much of it in a very low income, predominantly Black, historically redlined neighborhood. And there's a lot of highly vulnerable populations that have been impacted. And as we're working on response, we hear some political commentary that's things like, well, they were homeless before anyway. And so it's like, how do we build the case that by not addressing this level of vulnerability and the response creates a long-term downstream impact for the city? So I'm just looking like, what's the research case or the real life experience case for by focusing on, because instinctually it feels like that's what we need to do, but by focusing on the most vulnerable, we are creating long-term outcomes for the city that should be favorable.
Thank you so much, Jennifer. Would any of the panelists like to respond?
Well, I don't want to leave your question unexplored. And I think there's two ways, and I draw on the work of Jonathan Fielding, the former public health director of LA County. He wrote a brilliant, well, he edited a brilliant book called Public Health, What Works. And as I understand it, he and his colleagues really also made the case that working on behalf of every community benefits the most vulnerable communities as well. And it's really what you're asking, Jennifer, is really, at the core of our societal challenges right now, which is what is the best way to, as the military and others say, not to leave anyone behind. And you're asking a really profound question, which of what's the research say is the best way to get at those areas of St. Louis or Camden, New Jersey, or East St. Louis, any place that has really suffered institutional and organizational neglect and worse. And I think it starts with asking that question, but I think it also entails how does it affect all of us that, whether if you live in St. Louis, how does it affect neighborhoods that weren't hit by that tornado? Like, and why is it important? And I think the trust question is built not simply in the organizational response, but in more dynamics than just that. And that's why I start with the trust question. I don't start with the performance question. And the question, because everything else is predicated on trust. If there's not a sense of community trust that taking care of that neighborhood or those neighborhoods in St. Louis is important to everyone, then it doesn't matter what research you cite, right, Jennifer? Like it's just so. How do we get at the trust? And this gets at the question that's being put there as well. In there is uh, credible information. The question that Louise asked, like, if people don't believe the information, Jennifer, that you're putting out or that anybody's putting out, then it doesn't matter like what other research you cite or find. And so, to me, the starting point needs to be how to get at trust, which then allows for information to be seen credible, which then allows for more effective action. And I don't know the particular circumstances you're in, but and I recognize sitting here and sitting in a professorship, it's a lot easier for me to say these things than it is for you or for Renia or anyone who's working at the front lines of this. But I'm just suggesting thinking about really dealing with the trust questions first across communities and then getting at the performance question. And I welcome a continued dialogue on this, Jennifer, offline. I'll put my email up there and you can certainly, I like hearing how my ideas might work. I really value hearing about how my discussion was entirely unhelpful and how I need to think about it differently. So let me put my email out there.
Jennifer,
Absolutely. Thank you.
Jennifer,
Yeah.
your point also made me think about the work of Carolyn Barnes, who's at the University of Chicago, and she studied in South Carolina, I believe it was disaster responses after significant flooding. And again, there were many communities of color who had felt that historically they had not been prioritized, and prioritized both for in the context of the response and in how we think about communicating with them, right? What are the additional burdens or challenges they face to getting information or acting on information. And so I think, you know, Carolyn Barnes' work really interestingly talks about some of the ways, this is not throwing more money at the problem. It's about how we communicate with people, the challenges unique challenges that they face, or how we tailor our design of systems of information that recognizes, the additional supports these people may need, or your point made me think about this, your point that, oh, well, they were homeless anyway, so why should we prioritize them, right? This is their life. So I think, and what we have done in the past, right, adds to those barriers, to those people feeling confidence that they will be effectively served by our government.
But I appreciate the comment, especially about how the information sharing and information systems themselves create barriers to access and sense of exclusion, and how they're designed. And that creates this opportunity to build at least some bridges and maybe some little bits of trust.
Yeah, thanks. Maria, I know you want to weigh in this too.
Yeah. So I just want to mention, Jennifer, that when we were working with the panel on vaccinations and hesitancy, there was a African American member from Mississippi on our committee that said, it's not just the message that you want to convey, but who conveys the message. She found it so much more helpful to have the Black minister in the, poor areas of Mississippi talk to the communities about the importance of the vaccine than it was for any of the public health officials to just broadly announce that it was necessary.
Yeah, so I know, Louise, you want to jump in, but also, is it Rina? Or Rina?
Yes.
Yeah,
Hi.
you also posted I think a related comment, and I could read it, but as long as you're off mute, I'd love it if you would go ahead and share your insight on this issue of trust.
Sure. Speaking to the issue of trust and specifically in COVID itself, I think there's a very large elephant in the room that no one, by virtue of the fact that we were physicians, no one's really going to step up to us and say, hey, you guys bear some responsibility into this as well. But one of the things that dismayed me about the COVID response among my colleagues is that I never, ever thought politics would trump the science. And there was no pun intended in that at all. But politics came into medicine in a way that I had never, ever seen it before. And it was so very disillusioning to see that, because then in the midst of it, you're questioning your colleagues, whereas we're fighting for the lives of ourselves, and we got two competing meetings, sorry. We're fighting for the lives and sometimes our colleagues, but definitely the patient populations that we served. And our message was not on point because there was division among us based on red and blue upon politics. I had never seen that in medicine before, and I don't think it served us well. And it's also leading to the distrust in the message that we're getting. So then you start seeking either a doctor who you thought was a Republican, or a doctor you thought that was a Democrat, but however their politics was, you started seeking those people out instead of seeking out the science. And until we repair that breach, until we can bring ourselves back to where medicine is completely rooted in the science and not in the politics, we are going to continue to have a trust issue.
Yeah, thank you for that really important point. I have a feeling we have a lot of work to do on that. Louise, you want to jump in? Go ahead.
I really just wanted to affirm what Maria was saying about the importance of the messenger. And we saw that here in California in COVID, because the COVID provided funding for what they called ambassadores. And these were Spanish-speaking people in communities that served Hispanics, many of whom were terrified of vaccines, would not talk to any government official, but these young ambassadores could come in and persuade them to get vaccines. Then COVID presumably ended, but what happened in California was the wildfires became much more urgent and much more difficult. And these same ambassadors, who were young people from the community, bilingual, were able to go into the community and persuade, inform people, persuade them. And the trust that was built up from COVID carried over into preparedness for wildfire. And so I think the lesson here is Maria's point is really an important one. It's building the local network of sharing information, valid information that people can trust. And after, in the wildfire experience, then some of these same people who'd been so worried became much more interested in not only public health, but in accessing other services for wildfire preparedness. So, good point, Maria.
Yeah, thanks so much. I know that Naim has a great question in the chat as well. I wanted to set up this topic just a little bit in that, you know, it does appear that, one of the lessons that we fail to learn, we experience, is the importance of sustained coordination, collaboration across government agencies at all levels, federal, state, local, community, for crisis emergency preparation. And then, of course, with current day relations, not just between government and the people, but actually relations across government, federal and state and local, we see tensions in that. And so those also can be more adversarial than cooperative. And so I think we have to think about what can we do today to overcome these barriers to collaboration. So I'm going to let Naim go ahead and talk about his specific question himself, but this idea that we can't just come to the attention after the crisis happens. We can't keep as I think Geno mentioned this too, we learn, relearn, we go back, and we don't sustain this. So I'll let you go ahead and come off mute and pose your question, because I think it's a great one for the panel.
Yeah, I think you emphasize some of the points I highlighted in here. And Louise Comfort, my mentor from PhD, she's been addressing some of the issues I think highlighted in here in terms of information sharing, complex adaptive systems, networks, intergovernmental relations. But if you look at the research on certain crises, that includes Katrina mentioned in here, COVID-19 mentioned in here, this is really cyclical. And we focus those as in terms of policymaking, investments perspective, as a focusing events, and we forget about those. And I think the issues you addressed in here around trust, around intergovernmental relations, community connections, relationship building are really wonderful. But what is the role of academia? I think that was part of Rich's presentation, interdisciplinary nature. Academia can be a platform as a nonpartisan, bipartisan entity in terms of promoting some of the ideas for policy as well as research. So how we can develop some frameworks and ideas broad enough, interdisciplinary to sustain research can be applicable to multiple disasters versus case-based recommendations as we face certain disasters around the country.
Panelists who would like to respond?
Well, I think you really get at the difficulty and why we're having a discussion here, and the fragmentation of these discussions and the episodic nature of these discussions. And what Geno talked about earlier is societally, we're just not equipped to, one, learn lessons, and two, apply lessons. And I really think NAPA figuring out a role, and I really give credit to Carolyn and Louise, whose work I've admired for for years in different fields for trying to convene NAPA to look at this. And NAPA is uniquely situated to do this in a way that, the National Association of Public Health, George's Benjamins may not be situated, but could certainly partner with. And so, with any question like this, it really, I think you really called into question, what is the strategy moving forward, and how can the strategy really gather assets to work through this in an ongoing way that contributes and engages all the different players in this. I mean, Rena and I have a colleague from an earlier program at the Milbank Fund who's the public health deputy director in Houston. And a lot of her work on emergency response is through the federal DHS. And so not through this forum. So, um, uh, and the tragedy, as Geno points out and other discussion points out, I mean, if you look at Don Kettle's article on uh, the real failures as he saw them, organizational and intergovernmental, on Katrina in 2005, those same challenges are in place 20 years ago. And so your challenge is really a challenge to NAPA, how to get serious and sustain and broaden the engagement to, to develop thought leadership and then action leadership on this. I think today's panel with it, not panel, but today's discussion with, people who are working at the front lines, Jennifer and Renita and others, that's a model for it, but how do you really get traction on this? And so I think that's the next phase for this working group.
I appreciate that response. Who else? Geno, do you want to?
If I could jump in, Rich, and just paraphrase a little bit what you said too, and I think this hits the question a little bit. And Maria mentioned this too. Some of her work. You know, as we move forward, in terms of some of the concrete fixes, tying funding and performance evaluations to attract equity outcomes, because we all know that we've seen it disaster after disaster. It's not just some of the big ones, but just in some of the local disasters that our vulnerable populations are getting hit pretty hard. And yet, I don't know in our planning, when we sit down with the planners, those emergency response planners, the tabletop exercises have to start to bring in our populations. And we talk about, whole community, but we really have to start talking about the populations that we serve, that we take care of, and in terms of how they're going to be taken care of in the disasters that we see, whether it be fires in California or we see floods or hurricanes. But our vulnerable populations are really getting hit hard. When they get hit hard, media just pounces on it and it showcases the holes in our systems, in governmental systems, local, state, federal systems that are trying desperately, competing for funds along the way, but we continue to get exposed in terms of some of the inadequacies that we have in our basic plans. So it's something to think about, something that we need to focus on, but we only focus on things at times when the disaster's right around the corner, or we're in it, or after it. But these things don't come at us all the time. But when they come, they certainly hit with some impact.
Mm-hmm. Yeah, now I see a comment in the chat too, pointing us to Australia as a potential, I guess, model for how we can do better at systematic, nationally coordinated responses. And I think I just want to I know we're getting towards the end of our time. I want to just bring into focus something that maybe we can have some just closing commentary on this, that this could be very real very, very soon, because I mentioned earlier, there's news suggesting that we could have a supercharged El Nino this summer, pushing temperatures across the globe to unprecedented extremes, which we seem to experiencing every year already. They're talking about elevated hurricane activity, record-breaking heat, potentially the warmest year and ever, of course, flooding and other disasters that come along with these things. And I think we also know that, climate change itself has been a very politically charged and controversial topic, very much like vaccines, as we were talking about here. And so it seems like, knowing this is potentially very near on the horizon, what can we be doing right now or what should we be doing? We have so much we could do, so many populations that could be affected very broadly. What can we do right now to strengthen public trust and those channels for intergovernmental communication, collaboration, so that we are maybe slightly better prepared for what we think might be coming at us? I don't know if anybody wants to comment on that, but I've been thinking about how real this could be very soon. And I mean anybody online.
Yeah, Carolyn, I'd like to go back to this social networks and the informal communication avenues that we're seeing today, whether it's AI or social media. Can we use that as an information source for populations that may not have other information sources or that may actually prefer the use of the social networks to get information? I really, could see us doing so much more in that area.
If I may add, Carolyn, am I still, let's see, am I muted?
Nope, we're hearing you.
Okay. Um, Actually, I think there is something that Napa could do and do it actually very quickly in response to this El Nino. Because I think of the El Nino and all of the storms come, but then all of the foliage grows and plants and grasses. And then, at least in California and much of the Southwest, it dries up and it becomes fuel for wildfire. So, in these situations, one has to establish the understanding and the commitment to action ahead of time. And here, literally organizing sessions with nonprofit organizations can be very, very useful. And actually, an example is from the ASPA meeting where a Napa member was the director of a nonprofit organization in Los Angeles, convened a meeting here, bringing in local leaders, and was talking about actually healthcare at that meeting and response to wildfire. So I think in areas where we do have Napa Fellows, and many Napa Fellows are affiliated with other leaders, other research centers. I think of Naeem in Florida, and hurricane season is really likely to come up, Naeem. That this could be a vehicle for organizing valid information preparedness sessions before this next hurricane or wildfire occurs.
I also think along those lines, Louise, like our Tennessee Immigrant and Refugee Rights Organization and other organizations like that across other states, really mobilized, in the face of families were fearing, ICE raids and other things as we saw in Minneapolis. And those organizations, for example, were on the ground doing things like food delivery, getting people rides, making sure people had medicines and access to healthcare that they needed in a time of fear and of considerable fear. And so those might be organizations that, because they have developed those trusted networks with a population we know that has been very vulnerable in multiple ways in the context of disasters, that would be another, great network to promote and to help connect with people who are those experienced in doing disaster response, right?
Exactly, exactly. I think we can do that.
Anyone else?
Yeah, I'd
Like,
like to jump in really quick, and just in terms of strengthening the accountability and leadership through kind of that social equity policy lens, in terms, just a couple of points, that we need to continue to look at institutionalizing public dashboards, tracking equity metrics, going back to what we chatted about through evacuation success for special needs group, health outcomes by race and ethnicity, and long-term recovery rates. I really believe that, NAPA has been at the forefront of this with their longstanding commitment to social equity as a pillar of public administration. So we've really got to kind of work the leadership pipelines and performance measures that reward this cross-sector collaboration. I mean, NAPA's done a ton of work on the social equity side of the house. And we have to engage the affected communities in policy design and after action reviews to rebuild trust through that transparency and co-creation. So, public health is important. It needs to be at the forefront and in terms of the work that we do within our governmental public health areas and state, local, and federal levels. So we've got a lot of work to do, but we've got we know the answer. I think it's just how to operationalize what we need to do, and because we have studied this pretty hard.
Yeah, I want to turn to Paul's question in a minute here, or point in a minute, but I just want to follow up on one thing you said, Geno, and that is, bringing equity back into our dashboard so we're tracking those kinds of gaps. It's going to be very challenging to do that through government right now. I'm talking about someone who just had to remove words like equity and immigrant and any mention of race in government because of a government grant I have. So I think we are going to have to think about what are the other roles of other sectors to play when we aren't, doing that in a formal, official way in our government. And I know, Paul, you have, if you have time to say a little bit about your comment about what the Japanese government is doing right now and some of the questions around that, love to hear your thoughts.
I should probably preface my remarks that I am neither a public health expert nor am I an emergency management and disaster response expert. So I'm probably an outlier in this group, but very interested as a citizen and as someone who's been involved in a lot in natural resource management issues that cover local, state, and federal coordination. Plus, I spent 15 years in public service, in 5 years in local government, 5 years in state government, and 5 years in the federal government, working on issues of natural resource management, not disaster management. But I was just reflecting. I was born in Japan. I'm not Japanese. Two Greek American parents lived in Japan. I was born there. I have an interest in anything that happens in Japan. So watching what's happening this week right now, and I've just been reading up on kind of the way that the way that they have this coordinated response. It really plays to the comments made earlier about all these things were in place because they know the next earthquake is coming. They know the next tsunami related to that is coming, and they push the button and the system kind of operates from a communications perspective, from a command and control perspective. I think the whole thing is run right out of the Prime Minister's office. I think she is literally front and center on this. So I don't know what we can learn from countries that seem to have it nailed. And not that we don't have it nailed. To everybody's point, we know exactly what needs to be done, but there are like maybe weakest links in the chain. I don't know what the it's easy, like I said, it's easy to talk about this, very much a different story to execute. And but this is like a current event that we're living, that many hundreds of thousands of people are living with right now just across the Pacific. But this is just prototypical of what we're going to be facing as a nation in rapid fire. Like we're not exempt from a nonstop onslaught of natural related disasters that could be climate or weather related or related to other things. So I don't know.
Thank you so much. Anyone else want to add anything?
Actually, if I may add, Paul, one of the things that makes it even worse is that our federal agencies that have responsibility for managing natural hazards have all been, maybe decimated is too strong a word, but
Yeah.
have all been weakened considerably. FEMA, the National Weather Service, the National Geological Survey, all of the critical agencies, not to say the CDC, have all been heavily damaged, I guess I will say, by this administration, just as we are preparing, as Carolyn said, for a real onslaught. And I think this is a time when literally not just Napa, but practicing administrators at state and local levels who see and understand this problem need to work. Here, I'm going to make a plug for universities and for research centers because we tend to have more time available to organize and manage things. But I would like to see a sort of 50-state breakout of seminars, of policy, of actually listening sessions that are coordinated by perhaps Napa leaders and partnering with their local organizations to bring this issue to people before it hits. What we do know about information, and one of my longtime mentors years ago told me the most important thing that people need in disaster is information. So providing valid information ahead of time, enabling people to prepare, to take the steps necessary, and to connect with one another at their local levels, I think will enable us to get through what is likely to be a difficult situation of storms and disasters. My thoughts.
Thank you, Louise. Okay, I know we are getting to a time to wrap up. I just want to thank very much Jillian and the National Academy of Public Administration for helping us to convene this public health working group and the 3 webinars that we've had. I think that, and thank especially today our panelists, Rich, Maria, Geno, Louise, for your support of this, and the attendees who really enriched our discussion. And I have a feeling that we are going to have more to talk about. This summer could prove to be very challenging and coming fall. And of course, we have, as we've all been talking, these are long-standing issues. These are deeply important issues in terms of our governance and the effectiveness of our governance, but also in managing, I think one of the things that has such serious and at times very lasting impacts. For example, we can think about Katrina, right? How deep and long the impacts of that hurricane have been and are still felt today. Generations of children, and whose schooling was impacted in homes and everything. So it's critically important, I think, everybody for being a part of this discussion. Thank Napa for hosting it and promoting it. We know that there are a lot of people who couldn't be here, but who will watch us later. And we look forward to continuing to work with Napa and those who have interests in advancing what we can do in the future to help us prepare better and to be more effective in how we take care of people. So thank you all for your contributions. Does anybody else want to add anything before we close?
Julian, will this be available as a recording to share with others?
Yes, it will.
Outstanding. Thanks so much.
And Jillian, I'm sure you will email that to people who registered, right?
Yep.
Great. Thank you. All right.
Great conversation.
Oh, to be continued.
Yes.
Thank you all.
All right. Thank you again, everybody. Have a good afternoon.
Thank you.
Thank you.
Bye.